So I think with these questions we've been asked to keep the answers pretty short. They're good for this part of it. But if you have any more detailed questions afterwards, and most of us I think are sticking around for the second part of it, we're happy to answer more detailed questions in the following part of it. The first question I was asked to look at is what EMR features do I find the most time saving? And I think there were four things that came to mind immediately for me. One was the ability to make templates for yourself. And one was the ability to create a favorites list of prescriptions for yourself that are not necessarily specific to each individual patient where you're automatically doing refills, but where you can have things, your custom derm creams and things like that that are pre-printed with the way you like it done, and you can just click and that's done for you each time. I also really like lab requisitions where you can have the ones that are doing the same thing all the time. First prenatal, you click that, everything shows up in it and you get print. That's really nice. The fourth feature I really like is within the EMR, I like to have the chart all available to me on one screen. So there's a scrolling chart. It drives me nuts to be constantly flipping back and forth with each encounter being in a separate window. I find that really time consuming. So I like to have the chart all laid out to me on one screen.
Great, thanks very much. Please.
The question that kind of spoke to me was, one question was, which EMR is easiest to learn to use? There's many different ways to answer this. I think you have to ask yourself what kind of computer user you are. Are you a person who really likes to use a right-click function? Then one of the EMRs tonight has a lot of that. And so it's, you right-click and you find either consults, or make a medication, a requisition, then maybe that's an EMR that you'd be more interested in exploring. The other thing to consider is how compartmentalized you like your information. So for instance, one EMR, the main page has everything, your chart note, your medical history, your prescriptions, kind of all on one page, so you can just click that and you're there. Some of the other EMRs is a bit more hidden. You have to go to a different screen. The entry of it, you have to go to a specific box and enter your CPP. So how much compartmentalization you want may influence which EMR you choose. And I think those are just to start off, two things that you may want to consider: how compartmentalized you want your patient encounter to be, and like if different functions such as right-clicking or keyboard shortcuts are something to consider.
So one of the questions I was asked to go over is, was I able to easily use the EMR to teach and counsel patients? One of the features that I find most powerful in any EMR to be able to counsel patients is the ability to graph lab results over time and to trend them, and also to maybe be able to easily provide a list of, for example, recent blood pressures or weight changes over time just by clicking. Some of the EMRs do this really well, some of them don't. Like, for example, I guess Oscar would be one that you can easily see all the lab values. If you were to click on, for example, GFR, you could see a whole list of the lab values, but you wouldn't be able to graph it as of the version right now. Some of us were just talking that these EMRs keep updating, so over time maybe that might be a function that is available. Whereas some of the other ones like Wolf and Profile,
it is available right now.
it is available, so there we go. Okay, so I haven't found that. I haven't been able to find that feature, so it's not something that.
Even the latest,
at least for 2 years.
Okay, so there you go. I stand corrected. So maybe some of them are easier to find that graph feature than others. That would be one of the more powerful things I think, and a lot of, I guess all of the EMRs do that.
Okay, so the question that I wanted to answer was, can you tell us whether you prefer tablets, desktops, laptops, and why? And I think everyone has their favorite type of computer they like to use, but as a locum, when I go into someone's office, I really do like it if they have the desktop version in each exam room, especially if they're transitioning through the chart to EMR period, because when you're carrying a paper chart and a laptop and trying to introduce yourself, like sometimes things fall, it's a bit cumbersome. Other things is that the larger the screen, in my opinion, the better it is. If you're the kind of person who wants to see most of the things on the screen, like say for example, Oscar, if you want to see their past medical history, medications, family history, all on the same screen, you don't want it super small. The other thing is I really like having a real mouse. I just think it's easier to point to exactly what you want on the screen. And if you have those little tracker mouses, it's sometimes just it's a little bit more finicky. So, in my opinion, bigger is better, but if your exam room is small, sometimes you do have to have the portable laptops.
Jeff?
So I can choose any question out of the list here. Well, I think actually the first question here is fairly fundamental and might help with some of the slides I'm going to talk about later on, and that's what is a health information access layer or HILE, and why is it important to have an EMR that can access and exchange information with it. So this nebulous thing called the HILE is a fairly core central piece of technology in the provincial electronic health records sort of system. And I think the easiest way to think about it is it's the gateway to the provincial sort of clinical information that we hold in various repositories like our PharmaNet system or our provincial lab solution. And it controls access to health information that you are trying to access from within your EMR. And I think so to look at it from a particular sort of use case, if you're in your EMR and you want to access a patient's medication profile in PharmaNet, your EMR would send out a message to PharmaNet saying, I've got a PHN and I'm sending a transaction to retrieve this drug information. And that would go to the HILE, and the HILE would check to make sure, okay, is this coming from a known, trusted EMR that's been tested and connected, and is it coming from a known sort of medical practice location? If it is, great, then it'll check the individual that's actually submitting that request. Is it a known person to the HILE, and then also, do they have the authority to send this transaction? If all that works out, then the HILE will allow that message to go through and access PharmaNet. And PharmaNet would assemble the medication profile. It does a few things on its own to check and sends the information back through the HILE to the EMR, where it then is presented within your patient chart. And that whole kind of transaction is sort of logged and audited for security reasons. And not that there's personal health information retained in those, but it captures sort of the provider, the date and time, and the type of transaction that happened. And so that infrastructure is used, will be used by every EMR that's connected to our provincial systems to do things like e-prescribing and to access historical lab results.
Oliver.
Okay, and the one question I want to address is one of our panelists actually addressed this, is discrete data and non-discrete data, and why it's actually important. And in simplest terms, the non-discrete data, it's faxes, which we use today, it's pictures, so there's actually information in there, but you can't really do anything. You can read it, and then if the fax image is very, very good and very crisp, you can actually have some software come and actually analyze it and actually try and pick up some of the words. But there's not a lot of intelligence behind that. So if you were to get a bunch of reports going into your EMR, which came in through your fax, they're basically pictures. Discrete data, this is actually the actual text words and text numbers behind the data. So this is data which you can then bring into your EMR, and you can start to analyze it. You can start to use it. If any of you are familiar with Excel, Microsoft Excel, It's basically putting in the numbers and actually taking them and, as mentioned over here, being able to graph those results. Being able to take your medications, which are prescribed using discrete data within your EMR, and graphing the medications on top of the actual results. So you can visually see, okay, great, so the actual levels went down when I started prescribing this medication. So it's really the value or it gives you the ability to extract the information out of the actual data itself. And I know that Jeff and my group, we're really working towards getting as far as we can down that discrete, or sending as much discrete data as possible. The HILE, mostly works within discrete data. There is still some PDFs that go down there. At the Health Authority, we're just going through a huge initiative to start sending more and more results out to EMRs. And again, our focus is as discrete data as possible.
So what I'm going to try and do is put EMRs in perspective for you. People sometimes look at their EMR and they say, well, I use my EMR in my office. And it is very much like purchasing a car and having your car and you driving it around in your driveway. So you use your EMR in your office as you would drive your car in your driveway. But at some point in time, you may want to leave your driveway and go out on the street and go on the highway to get places to do things. Now, there is a difference when you look at your EMR if you are just using it within your office as opposed to using your EMR as a communication tool to link up with many other databases and computers. And so there is some consideration about what do you want your EMR to do? Do you want to just drive around in your driveway, or do you need to go out to other databases to interact, to go to some of the databases that Jeff alluded to? And so what I wanted him to do is to take a few minutes, and I want you to, in your packages, pull out this color slide. It's entitled BC EHR Context. And so it's really important for people to understand when you're using an EMR, I think people have a clear idea of how you're going to use it in the office. But there's been a great deal of thought about how we're going to be able to use our EMRs in the grander scheme and how it fits in with the entire e-health plan for BC. So, Jeff, if you can take us through this slide and help us understand exactly what things go in and what does it mean and how are we going to be able to interact with them.
Sure. And do you want me to stop after this first slide or to cover the other two slides?
I think we'll cover this one first and we'll see how we're doing at the time.
Okay. So it sounds like everybody's got the slide up with the sounds of the shuffling of the paper. What this diagram sort of displays is it's trying to convey a bit of the context of our electronic health record systems or infrastructure here in BC. And for the last several years, we've been developing these systems and connecting them together and trying to get to the point where we can allow more clinical information exchange from our provincial repositories to you in your medical practices. As well as also to support clinical data exchange in a variety of other points of care, hospitals, obviously, and other community locations. A number of the systems that you see across the top, some of them have been in existence for probably close to 10 years. Our clients and provider registry systems, which contain information, demographic information about both providers and patients. Our provincial laboratory information solution is a relatively new sort of clinical system that retains all of the public and private lab results here in BC. PharmaNet is obviously a provincial system that probably many of you are familiar with, and that's contains all of the dispensed drug medication, drugs and medications in the province. And other systems, far right is our public health new Panorama system, which has been built. And these systems, the goal is to connect these things to what I talked about before, the health information access layer, or HILE, so that at the bottom you see that there's viewers and physician EMRs, topic of today, which is connected into the health information access layer and able to retrieve discrete information from these locations. So this is, much of this is already in place. The work to do right now is to actually start to deploy this functionality. Some of the slides that I'll be talking about later on is that roadmap is we're really sort of laying the foundation by getting physicians onto EMRs. Now we want to actually connect them to these to the provincial systems so that you can get even more value out of your EMRs and get more valuable information about your patients which you may not have had access to previously. And certainly in the future where we're going is things like, although our focus right now is on providing access to PharmNet and our lab solution, there's great value in providing access to immunization data, which is starting to be populated, and to allow two-way data exchange as well, so that if immunization records from that are in an EMR can even make their way into Panorama, so that other care providers can be aware of what a patient's immunization sort of record is. So this is a contextual sort of picture. It's not meant to be a technical diagram and accurate in every particular way, but it does give you a sense of that there's a very important place for community physicians and EMRs in the provincial EHR vision, and connecting to a variety of clinical systems that we have now in place. And when you look down here in the bottom, the gray picture, in the gray circle it says physician EMRs. Mm-hmm. And so you're talking about, this is where it connects to HILE. Can you tell us about things we need to know about our EMR to make sure, or question whether we can connect to the HILE? Yeah, it's we do have to point out that we're just at the start of a long journey of enabling this type of capability. We've been doing this calendar year pilots in a couple of locations of e-prescribing with a single EMR connected to the HILE, and that's able to exchange demographic data and acquire PHNs from the provincial client registry system, and also to download medications and to do electronic prescribing. So just in a couple of communities, a couple of physicians, and we've been doing this as sort of an early adopter phase to make sure that we've got the integration set up properly, and that the systems are working and behaving the way that the physicians need them to. So it's being done. We need to do more of it with more of the EMR vendors in the office and or in the room here. We do have fairly rigorous standards, what we call kind of conformance standards or integration standards that the EMR vendors need to meet to connect to the system, and to make sure that they are basically fairly mature, robust solutions, and they're properly managed and are done so in a very secure manner. So those are things that you yourself don't necessarily need to worry about. You need to make sure that your EMR vendor is worrying about these things, and that they're making an effort to do the integration. It is because there is time and effort and investments that they need to make to do this type of work. You want to encourage them to do this so that you can get this benefit downstream. And so I think you'll be looking for vendors that have a sense of where the province is going. They should know where we're going. We've reached out to all of them to give them this kind of talk, and see what are their plans to start to do this type of integration. And hopefully you're hearing positive things from them, that they are going to do this type of work. Oliver?
Yes, and if I can just build on that and just really address the topic of complexity. This next level of integration, it's an entirely different dimension of complexity. So if you think of integration, it's as simple as, receiving a fax. Your EMR can accept the fax and you can go directly in there. Fantastic, I'm integrated. Or you can actually, you can send a fax from your EMR. You can create a form and you fax it off to the EMR. Fantastic, I'm integrated. That's I'd say just your basic level. And then you've got a nice level above that, which we're all familiar with, where you have a vendor like Accelerus, which is delivering lab results, which is Accelerus sending you down information which your EMR sort of picks up, actually consumes. So a nice level of complexity, but fairly doable, fairly widespread. The level that Jeff and his group is taking us to is a quantum leap past that, because it's more of a conversation. It's I'm going to prescribe, so I'm going to go off to this other system, and I'm going to have a conversation back and forth. I'm going to send information, it's going to come back, it's going to come back and forth, and that conversation itself is quite complex. And if you get something wrong, then the conversation dies, and you don't come out ahead. There's nothing's happening. All elements of the conversation have to go correctly in order for you actually to come up with a successful result. So it's quite a bit different than what we had before. So I think just to sort of build on what Jeff was saying is that the ability for a vendor to step up, to have that conversation, to actually put resources behind it, and commit to going down and investing in that conversation and investing in that next level of integration. That's absolutely true.
And there are vendors in the room or EMRs in the room that can do prescribing. I'm not going to tell you who. You'll find out if you ask.